So what other cutting edge research were we discussing at the AECOS meeting in Aspen, Colorado recently? One of the hot topics was the technology of EPI-ON cross-linking. Many of my cornea specialists will know that the idea of cross-linking is to strengthen irregular corneas called keratoconus, often associated with either genetics or chronic eye rubbing. For those out there who rub their eyes, please don't. If you have allergies or something, please seek an allergist opinion. Super important not to rub the eyes because it can, over time, really weaken the corneas. Anyhow, if you've already developed keratoconus, cross-linking helps strengthen the cornea and prevent further progression of this disease. The challenge is we have to simply move aside the surface cells called the epithelium before we can get into the meat of the cornea and actually help infuse this medication into the cornea and strengthen it. It is not a fun recovery because the surface cells have to heal on their own. Imagine a surgically induced big scratch on the cornea. It hurts. So the epi-on cross-linking technology is super promising because what it hopes to achieve is still the same strengthening of the cornea, but in a way that is much better tolerated by patients, much more comfortable with faster recovery, and also allows further safety because, again, once the epithelium of the cornea is removed, it does increase the risk of things like infection and haze and inflammation and all that. Whereas keeping it on, aka epithelium on cross-linking, avoids some of those concerning risks as well. So we really hope to see it. I think it may be gaining FDA approval in 25 or 26. And if that's the case, it's going to really open up the candidacy of patients who not only have frank keratoconus, but even those who are suspects, because uh, the downside of doing this procedure is much lower as well. So stay tuned for that epi-on cross-linking for those with keratoconus or even suspicious milder version of keratoconus.